Over the past 2 decades, Uganda has made significant progress towards the attainment of universal health coverage. The UHC Service Coverage Index score for Uganda increased from 22 in 2000 to 49 in 2021, which implies that investment in the health sector is bearing fruit. The World Bank, a major funder to the health sector, emphasizes the importance of investing more in health for human capital development and for the sustainable growth of the nation.
So, this topic, we've explored it in a very interesting discussion today. Health, most people don't see it really as being essential for the economy, but I think today it's come through much more clearly what needs to be done there on both sides, avoiding people falling into poverty, but also making sure that they have grown and been healthy enough to be able to contribute to the economy.
This was at the release of the 23rd Uganda Economic Update, whose half-year release focused on public health spending on health. The report notes that demographic pressures, changing disease burden, and prevalent public health emergencies are increasingly putting pressure on the health systems in Uganda. Top 10 causes of deaths in health facility increasingly due to non-communicable diseases.
Right now, somebody comes into your house as a patient is actually representing about 15 other patients in themselves because of different forms of complications packed in one person. So health workers are no longer able to deal with huge numbers of patients, especially with our growing population, if we do not cover the gap of the health workforce requirement.
Many of the NECDs, of course, is a lifestyle issue. We really needed to see how to appeal to the people who are going through school, the corporates, the way we feed, the way we celebrate. Some of these things, we can actually reduce them markedly.
Experts argue that over-reliance on external financing and regressive out-of-pocket expenditure makes the health financing system exposed to uncertainties and risks. As Uganda ages closer to becoming an upper-middle income economy, external financing is expected to significantly drop, leaving the country between a rock and a hard place.
So we are relying heavily on our partners in terms of infrastructure, equipment, medicines. It will be actually a shock if now Global Fund or Gavi says in the next 2 years we are not able to support you, we would get more problems and lose all these outcome indicators we have registered.
The country needs to progressively start taking up that gap that is going to be created. I know some countries actually failed to immunize their children when abruptly Gavi funds and so on were dropped. So also from experience, countries that spend more of their own domestic resources actually have faster progress towards universal health coverage index.
According to the World Bank, public health spending challenges are reflected in health workforce shortages, maldistribution, and low productivity. Dennis Igoa and Charity Maureen for UBC News.